We've had so many traumas, strokes, TBIs. I just had to run. I was like eating a little bit really quick and I like just had to run to the trauma bay. I love the crazy. Here it is.
My name's Mariah and this is A Day in the Life of a Nurse, Night Shift Edition. I wanted to be a registered nurse since as long as I can remember. There are plenty of pictures of me in my living room with my syringe and my stethoscope up next to my dad on the couch. I've just had a passion for helping people for as long as I can remember.
It is now 6:54. Start of the night.
All right, guys, it is 7:13 p.m. We just got done with huddle, so now it's time to go get our phones and check where we're at for the day. I just got my assignment and I am the TN2 tonight, which means I am the second trauma nurse. So pretty much how I start my day is I will go through these trauma bays and I will make sure that they are stocked and ready for any traumas that will come in. I will talk to the off-going trauma nurse and get report. And I'll also connect with the rest of my trauma members on my team to make sure that we're on the same page. After that, it's really my job to round on all of the patients, on all the nurses, check in, make sure that if they have a critical patient and they need help with it, that I can assist them. All right, guys, we just got a call about a critical patient, so we're getting our room prepared. We're getting all of our stuff ready to get an IV established so we can have access to their venous system. We're making sure that all of our cords are set up on our monitor. We have suction and ambu bag. We're getting our bed ready and cleaned, and we're gonna get ready for the ambulance to bring in our patient. Best tips when you get to your shift is to just make sure that you have everything you need in your rooms, that you know exactly which rooms and which responsibilities you're taking for which patient. I always like to communicate with the nurses and the providers in my pod about which patients are the sickest and which ones need to be a priority. All right, guys, it's 10:36 p.m. I just got into the break room. We just had like 9 traumas come in. So you truly never know what you're gonna get in a night. I've gone some nights where there's been no traumas at all, but we just had a huge group of them. So yeah, busy night already. It's really challenging being in this high stress situation all the time. You know, we learn to adapt to some of the worst circumstances. And I think trying to just make sure that I'm taking care of myself when I get out of this hospital is really important for self-care. I love to work out on my Peloton bike. Even a 30-minute ride after work can clear my head. I reach out to friends often. I've built a wonderful support system around me, including my girlfriend and her family, my friends, my family. I think just really making sure to take care of yourself and being such a high stress situation, I think that's really the most important self-care you can do. Hi guys, I'm literally filming in the bathroom because it's been so crazy. This is my first pee break tonight. It's 2:40 in the morning, so a little bit day in the life, right? I have not stopped all night. This is about the time that things start to either amp up or wind down. So I'm really hoping that it winds down because we've had a really, really crazy night. But right now is when I really start to try to get all of my stuff together for the next shift to come on so that if things hit the fan and we get a lot of critical patients, that I'm there to help the nurses. So come along with me while I do the ER logs. I am sitting for the first time my whole shift. I've just been sitting back and kind of thinking on this little break that I'm having about what is a good quality to have if you're going to go into nursing. Be adaptable to the places that you're in. Situations can change like that. And I think that being able to change to whatever environment you're in is really, really important. Second, I think to keep up on your education, always follow through and get more certifications, continue your education, whether it's required for your unit or not. Nursing is forever a learning profession, so you're never gonna be stopping your learning. I don't leave this hospital without learning something new that I didn't know the previous shift. Additionally, I seek out opportunities to get my trauma CEUs so that I can stay certified as a trauma nurse, as well as stay in good standing with my licensure. I think that those things combined can really help you be a successful nurse in this area. All right, guys, after a very long 12 hours, we are walking out of the hospital, out away from the ER, so that's it. Thank you for joining me in A Day in the Life, Night in the Life.
For more Day in the Life videos, please like and subscribe.